What is osteoporosis? Osteoporosis is when bones become weaker, which therefore increases the risk of fractures. The technical definition of osteoporosis is a skeletal disorder characterized by compromised bone strength, predisposing to an increased risk of fracture. Osteoporosis is a huge problem in the United States. Over 53 million individuals in the U.S. have osteoporosis or are at risk due to low bone density. Contrary to popular belief, bones are not just dead and dormant tissues in our body. Bones are tissues that are living and growing, and they are doing so throughout our entire lifespan. Bones have many functions. Some of the most important of these functions are that they make red blood cells throughout our body, they provide structural support, they help with body movement, and they also help store vital minerals like calcium and phosphorus. Bones are made up of a protein called collagen that provide that soft framework, and calcium and phosphorus are vital minerals that add to that strength and harden the framework. Throughout the lifespan, bone is broken down in what's called resorption, and then built back up in what's called formation. During our younger years in childhood and adolescence, we build more new bone than we break down old. As a result, bones are heavier, denser, and stronger. This rate of bone building peaks by about the age of 30. As we continue to age, we start to break down more old bone than we build new, leaving our bones less dense and weaker. For women, this bone loss continues at a faster rate starting at menopause. Osteoporosis occurs when the bone breakdown happens faster than bone formation. This is more likely to happen if the peak bone mass created by about age 30 isn't high enough. Unfortunately, there are risk factors for osteoporosis that you can't help. Some of these include gender, being a female, age, being a female over the age of 65 or a male over the age of 70, body size, being too small or thin, and ethnicity, Caucasian and Asian being of higher risk for osteoporosis, as well as having a family history of fractures, especially hip fractures. There are, however, risks that you can help. These include sex hormones. Having low levels of estrogen or testosterone can help increase the risk of low bone density. Therefore, talking to a provider about potential treatment for low levels is crucial. There's also calcium and vitamin D intake, making sure that you're getting enough in the diet or with supplement intake, as these are both a mineral and vitamin that are very crucial to the bone building process. There are also certain medications, like steroids, that with long-term use can increase the risk for low bone density and therefore increase the risk for osteoporosis. Lifestyle inactivity can also lead to low bone density and increase the risk for osteoporosis. Cigarette smoking and alcohol intake can also reduce bone density and increase the risk for osteoporosis. So what is bone mineral density? Bone mineral density is a principal measure for diagnosing osteoporosis. It's measured by measuring the bone mineral content in grams and dividing it by the bone area in centimeters squared. Detecting osteoporosis. How do you know if you are at risk? Well, there's a great risk assessment tool called FRAX. It's a WHO fracture risk assessment tool that identifies people at high risk of fracture. If you feel that you are at high risk, or if you fall under a category that puts you at high risk, you may qualify for a bone mineral density scan or a bone dual energy X-ray absorptiometry scan. DEXA scan sees if there is low bone mineral density before a fracture occurs. It also confirms or denies a diagnosis of osteoporosis and can predict change of future fractures. A DEXA scan is a relatively easy procedure with minimal or no patient burden. Radiation exposure is very low and it's at a relatively low cost. Let's delve into how exactly exercise can help increase one's bone mineral density. Bone mineral density, in order for it to benefit from exercise, needs to have an increase in force applied to the body. People who are active have better bone mineral density than their inactive counterparts because of an increased amount of forces applied to their muscles and bones. Exercises that involve varying weights are more effective with increased bone mineral density. Weight-bearing exercises exert a greater amount of force onto bone, which thus causes the muscles to pull on bone during contraction and in turn creates greater bone production. Overall, Exercise helps bone increase bone mass, muscle strength, balance, posture, and fracture healing. Some examples of exercises that exert lower forces on the bone include swimming, running, biking, and walking. Walking itself has been shown to help maintain bone mineral density, but not necessarily improve it. To improve bone density, one needs to incorporate exercises that exert a greater force on the muscles and bones of the body. Sports strongly accredited with high bone mineral density include gymnastics, volleyball, basketball, tennis, and weightlifting. All of these activities exceed forces of 10 times one's overall body weight. It is important to incorporate exercises that promote proper posture, muscle strength, balance, and flexibility to ensure one is achieving a well-rounded exercise regimen. The following are various activities or exercises that you can begin to implement to help increase your bone mineral density. Corner stretch postural exercise. Find a corner of the room. Extend arms to the wall and keep at shoulder level. Step 1 foot forward. Allow knee to bend and lean into the front leg, bringing head and chest closer to corner. Hold for 20 to 30 seconds. Switch and then repeat with opposite leg. Repeat 2 times for each leg and then complete exercise 3 times per week. Hip and back strengthening. Stand straight with one hand to the back of the chair. Do not bend at waist or knee. Place other hand on top of pelvis and raise the leg straight out the side. Keep toes pointed forward and do not let the pelvis rise up. Lower the leg and repeat 10 times. Complete exercise on the opposite leg. Do this exercise 2 to 3 times per week. Once proper form is achieved, add ankle weight. Prone leg lifts. Lie on stomach with hands at your sides. Place towel under forehead, shoulders, and abdomen for comfort. Bend right leg slightly and lift thigh off the floor. Keep foot relaxed. Lower and repeat 10 times on same leg. Switch and repeat exercise on opposite leg. Do exercise 2 to 3 times per week. Once proper form is achieved, add ankle weights. Balance exercise. Stand straight, hold back of the chair without bending at the waist or knees. Raise up on toes and then back on heels. Repeat 10 times. As your balance improves, you may hold onto chair as little as possible to challenge your balance. Do exercise once a day. Wall slide. Stand with heels 1 shoe length from wall. Keep feet shoulders width apart and pointed straight ahead. Place buttocks, palm, shoulders, and hands against wall. Tuck chin to ensure back of head is as close to wall as possible. Also keep abdomen pulled in throughout exercise. Slide up and down, bending knees to a halfway sitting position. Keep shoulders back and abdomen flat. Keep back in a flat position. Repeat 10 times and do exercise 2 to 3 times per week. The hard part of our bones is mostly made up of calcium, but calcium is also needed for muscle activity. If we aren't eating enough calcium, then our body steals calcium from our bones to keep our hearts beating and our bodies moving, which unfortunately can lead to osteoporosis. Vitamin D is also necessary for calcium to be absorbed into the blood. Stress, inflammation, and free radicals can cause oxidative damage to our bones. Oxidant-rich foods therefore can help prevent that damage by neutralizing free radicals. So what should I eat? Well, good sources of calcium include milk and dairy products, sardines with bones, salmon, chard, kale, bok choy, and good sources of vitamin D include fatty fish, mushrooms, and fortified milk and orange juice. Good sources of antioxidants also include berries, pomegranates, and red vegetables. But let's not forget your prunes. Studies have shown that at least 50 grams of prunes per day can actually help maintain or even increase bone formation in older adults. So how much do you need? For calcium, it depends on your age, gender, and hormone status. Women lose bone at a faster rate than men after menopause and up until about the age of 65. Estrogen is protective to bone, so postmenopausal women who aren't on hormone therapy need more calcium than a premenopausal woman. What does meeting these recommended intakes look like? Well, 1,000 milligrams of calcium is about 1 cup of yogurt, 8 ounces of a glass of fortified orange juice, 3 ounces of salmon, and 1 cup of collard greens. 800 international units of vitamin D is also about equal to 3 ounces of salmon, 3.5 ounces of mushrooms, and 1 can of tuna. So what if I'm still not getting enough? It's hard to get enough. If you don't think you can get enough from your diet alone, make sure to supplement with calcium and vitamin D. Also, make sure to play outside. Vitamin D can be made in the skin when it's exposed to UV light, so go enjoy the sunshine for a few minutes before you put your sunscreen on, if your doctor says it's okay. But don't think you can get away with just getting your vitamin D from the sun. Our skin isn't as efficient at making vitamin D as we age, so it's important to have a strong dietary source of vitamin D as well. But a little sunshine doesn't hurt.
I love fruits. Eat your fruits.